Hello, this is Dr. David Greene, CEO of the Arizona Pain Network. The topic today is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point in life. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks. An unfortunate few, 5 to 10%, will end up with chronic back pain. So acute back pain is 6 weeks or less. Subacute is 6 to 12 weeks, and then it's defined as chronic when it's over 3 months. Back pain is the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. Back pain is the most common cause of disability worldwide, and when you add up the indirect and direct cost of back pain each year in the U.S., it's $100 billion. So what are the causes of back pain? Well, I've broken them down into 3 categories. One is soft tissue, the second is bony tissue, and the third is uncommon. So for soft tissue causes, the most common cause by far is back sprain or strain. You bend over to pick something up, or you're involved in a sporting activity, and you either sprain a ligament or you strain some muscles in the back. The second cause is degenerative disc disease. This can be due to either genetics or repetitive microtrauma. What you see on the left is an overhead view of a normal-looking intervertebral disc. You have an outer coating called the annulus fibrosus. It's harder, it has nerve endings in it. And the inner gelatinous part is called the nucleus pulposus. That actually has no nerve endings at all. What you can have, now we're looking from the side, as you get degenerative disc disease, you have a healthy disc looking here, and then you have a moderate amount of degenerative disc disease, some bulging going back, and then with severe, it's sometimes even hard to see the disc at all. Okay? So when you start talking about bulging discs, tears, and disc herniations, those are all really due to degenerative disc disease. What you can see here is a pretty normal-looking disc, gelatinous inner part, annulus, but then some tears and fissures here, and that can be very painful because there's nerve endings. Okay, if it gets to a point where it starts to bulge and then herniate, a piece of the inner part comes out, that can pinch on a nerve root and cause significant sciatica. So sciatica is when you have one of these nerve roots being pinched up here that comprises the sciatic nerve. You can end up getting numbness, pain, pins and needles down the back of the leg, maybe the side of the leg, maybe part of the foot, but it all depends on which nerve root is being compressed. And here's what you see. You see a disc here with some bulging, and the bulging in and of itself can pinch on one of these nerve roots. Okay. So when you start getting into the bony causes of back pain, the number one by and large is just plain old arthritis. All right, the joints of the back start to get arthritic. You get bony overgrowth and bone spurring, like you see down here. All that's in conjunction with degenerative disc disease, and it can just cause, chronic daily back pain. It might get worse. It might wax and wane. So when you start talking about sacroiliac joint pain, we have 2 SI joints, one on the left side and one on the right. Okay, although actually we're looking from the front here, so this would be the right. But they have cartilage just like other joints, and they can get arthritic and wax and wane with pain. Up to 25% of back pain is actually coming from the SI joint. It gets referred into the back. Okay, so that's something to be aware of. When you start talking about scoliosis, here's an example of degenerative adult scoliosis, where you start to have breakdown of the discs, and then you get arthritis, and it's not symmetric, so what you can end up with is a curve scoliosis. People think of normally scoliosis in adolescence, but no, you might have none in adolescence and start to get something like this in adulthood due to it. It can be very painful. Spondylolisthesis is a fancy word, but basically what it means is one vertebrae slipping on the one below it. Okay, so what you can end up happen is nerve roots can also get pulled. That can start to cause some leg pain, but this can also be painful just due to the arthritis that it sparks up. Okay. Spondylolysis this is looking not from the side, but more of at an angle. It's more of a stress fracture of this area called the pars interarticularis. So basically it's a stress fracture of the back. It can be very painful, and it often occurs in athletes. In spinal stenosis, this is looking down on, this is the spinal cord, and this is arthritis affecting where this nerve root is trying to get out. It can start to cause some leg pain, and just from the arthritis itself, that can cause back pain. Okay, so when you start talking about the uncommon causes of back pain, there's really three. There's infection, and that might be infection of the disc space, which is called discitis. It might be infection of the bone, okay, which is called osteomyelitis. And whichever one it is, it's important that it gets treated. There's not really a home remedy for an infection. You need antibiotics, and you need to see a doctor to figure out what type of bacteria is causing the infection. Okay. Now, a fracture is what you see here. It's called a spinal compression fracture, and that happens a lot due to osteoporosis in older individuals and those with decreased bone mineral density. You can also have traumatic fractures from a car accident or some kind of a fall, and that can cause fractures that are much worse than a simple compression fracture. And then you have your tumors, which is, there's all kinds of tumors. You can have metastatic tumors, multiple myeloma, and things like that occur in the spine. So that's not really the focus of today's talk, but needs to be mentioned. The top pain management clinics in Arizona are Arizona Pain Specialists. They have 7 locations currently. They're really a one-stop shop for pain with medical and interventional pain management, chiropractic, spinal decompression therapy, acupuncture, physical rehabilitation. They offer over 50 treatments, and they accept over 50 insurances. They've won the Patient's Choice Award 5 years in a row. One number to call for scheduling is 602-507-6550. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.